Good afternoon, Chairman. Good afternoon, the co-chairman, rapporteurs, and all the delegates present in this hall. So, myself, Dr. Laxmi Priya Sahoo, and I am working at ICR Institute, Central Institute for Women in Agriculture. At Women in Agriculture, we are mostly working on the empowerment of women and particularly on their life and livelihood. So, it's a topic which is very less discussed when we are talking about the women-centric developmental initiative of government, which are mostly meant for the improving the livelihood of farm women and bringing empowerment. So, as we all know, the farm women or rural women, they are doing many activities which are unpaid activities, like the caregiving activities, home management. So, by imposing more of developmental initiatives through different programs, which are mostly family oriented, so women has to give time. So, there is a very delicate balance has to be maintained between the livelihood of women, the development and the life of women. So, I can tell that the quality of life for women, and what is the quality of life for women and why we are talking about that. So, whenever I am talking about the quality of life of rural women, we have to see some indicators like health and nutrition, their gender equality, their access and control over resources, cultural and social inclusion. All these things has to be come under the quality of life. But it's not possible. As a researcher or as a developmental worker, whenever I am going to village, it's not possible to address all the things which implies the quality of life for women. But these are crucial. What if we are increasing the income? What if we are giving them empowerment? At what cost? They should have bad health. They have very weak family nutrition. They have drudgery. They have illness. And what cost? And how the programs will be sustainable? And how we can tell that we are doing sustainable development? So, for that we have to definitely go for the quality of life. So, quality of life being a very qualitative aspect, the qualitative aspect that if my quality of life is good, if I am feeling good, if I am enthusiastic to do something, if I am healthy to take over something, then only I can say that my quality of life is good. But whenever as a researcher I have to see the quality of life, I have to devise some tangible things which I can measure, that the life quality is good. So, besides this all factors, I am only taking few tangible things like what is the participation, what is her participation in farm, non-farm, social and other activities, and how the efficiency of the rural woman is managed. She has to do a lot of things, and how these efficiently managed. Does she have some gadgets? Does she have some new ICT technologies? How she is managing her caregiving, her farm, her developmental aspects, children, education, and one and all things. Because a woman has to do more than 100 things. Then what is the economic gain? Whatever she is doing in participation for social development or other programs, policies, then what is her income, economic gain? Is she getting money? Is she getting the fair share of benefit? Is she a partner in getting the outcome? Or she is simply doing or undertaking the tasks and the result is taken by others. So that is also important. Then what is the social empowerment? Is she recognized in the society? And what is the social empowerment? It comes from technological empowerment, which gives rise to economic empowerment. So if she is socially empowered, she also takes part in politically things and gets more empowered. So these are the tangible pathways by which we can measure the quality of life. So for undertaking this work, we took it in a project mode and we selected 4 locations at ICAR-CIWA, then Ludhiana, Jodhpur and Jabalpur. We covered the arid and semi-arid areas of the country. So what are the interventions? what are the interventions? Because now only I have discussed that for measuring the quality of life or improving the quality of life, we have to focus on few tangible things only. So accordingly, we gave intervention on health and nutrition, drudgery reduction, income generation, then awareness through health camps. So for building the scenario, we took the baseline survey on health and nutritional status, resource availability, drudgery reducing activities, and need assessment for income generation. And we took 4 collaborative centers, and in each collaborative center we have taken 40 farm women, and on them we applied the interventions to measure their pre-project quality of life and post-project quality of life, so that we can compare the impact. So we found that 52.5% women are normal as per their anthropometric measurements. So for measuring the health and nutrition, we did some anthropometric measures, whether their body status is they are normal or obese, malnourished, and we found that more than 52.5% are normal and others are not normal. And they have 37% women were facing chronic energy deficiency from mild to severe degree. Because nutrition deficiency nowadays, we all are talking about hidden hunger, so that we are deficient in micronutrients, vitamins and proteins. But still in country we have the energy deficiency, chronic energy deficiency is still persistent in rural women. So they have the disease and health situation which was assessed, and it was found that tuberculosis and diarrhea affected the families from 15 to 30%. As large number of population were suffering from chronic energy deficiency, malnutrition, interventions has been initiated among 100 farm families. So we started intervention in 160 farm families. So while this is the data of chronic energy deficiency of the selected sample, and this is the disease and health situation. So we saw that 52.5% are normal, and more than 17% are malnourished. So for after studying the nutritional situation and the other nutritional analysis, we went for intervention for nutritional improvement, because nutritional improvement is very important. So we developed 160 nutrition gardens to reduce the malnourishment, and in those nutrition gardens we focused, because nutrition gardens were developed in the backyard of the farm families, so very less area. So we focused on protein rich and vitamin rich vegetables which will give them nutrition, particularly colorful vegetables, protein rich vegetables we developed. So third intervention was skill enhancement training. We conducted a series of skill enhancement trainings for giving them awareness, for interventions, for making nutrition gardens, for business management, for nutritional things, everything we gave a series of trainings. And we developed linkage with Central Food and Extension Unit, Government of India, and we imparted 5 days comprehensive trainings on food and nutrition. So nutrition education was given mostly on milk production and its utilization, because in rural areas people, they produce milk, they have cows, but women hardly drink milk or utilize milk. Then importance of kitchen gardening, importance of green leafy vegetables, then conservation of nutrients during cooking, hygiene, sanitation, and low cost winning food for children. So these educations were given very comprehensively to farm women. So the 5th intervention is drudgery reduction of farm families, and we provided them different tools, trained them how to use very small tools and very low cost tools, but that will reduce their drudgery to some extent. So revolving stool for milking the cows, then cow dung collector, lightweight hand cultivator, trowel sprayer, and improved sickle. All these things we provided and measured the impact. So 6th intervention was empowerment of farm women for income generation through backyard poultry, Then another off-farm activities like stitching bags and purses and animal management. So for this we have given some demonstrations, that is value addition to agro and animal based demonstrations. So in this we have grown different crops and found that the production, then gross return, net return and BCR, benefit cost ratio, and it's in the farmer's field, and so in some places the BCR is more than 2.6%. So while giving, I am summarizing the interventions. So fruit plants we have grown, then vegetables we have grown, then kitchen gardening, distribution of inputs, then income generation activities. So the impact is they saved approximately rupees 2,000 for family through vegetables, because they used to buy the vegetables and from kitchen garden they collected the vegetables. So this has different benefits like reduction of cost, then organically produced vegetables, so it supplemented to health, and they were empowered technologically for their own nutrition, family nutrition. So in they have income, generated income 2,000 to 3,000 through small candle making, wax making, all these things. So by empowering them in different technologies, giving them a community support system, we created an enabled platform for them. So in that platform they get support, institutional support, hand holding, and we tried to develop and strengthen their local level institutions like SHGs, their federations. So these create a multiplier effect and empowered them. So though we started with the, just improving their quality of life, we ended up with income generation and giving them satisfaction. They ate their own food, they got income, and for very petty expenses they don't have to depend on their husband. So these type of effects were found, and which was multifaceted and which has also good spilling effect. Seeing them, other women from other villages were interested to also come for these type of endeavors. So what are the checkpoints? Whenever we went for this improving quality of life, first is community. So community mobilization, their exposure, strengthening the grassroots organization is the first point. Then their awareness creation. For this we created outreach programs. Then we created a platform for them which they can participate, and their participation behavior can be positively manipulated. Then interventions that should be location specific, and the location specific need based women friendly interventions were very important to bring a positive change in that endeavors. And then impact. For getting the impact, we did concurrent evaluations. At all stages, all points we did evaluations and we measure corrections. So this is the checkpoints where we regulated our interventions endeavors to study. We wait a little, study it, then we proceed. In spite of going in a linear manner, in every checkpoint we evaluated ourselves. So what is the way forward? Because this is the reality that we are going for village centric development, and more specifically we can tell that we are going for women centric developments. So women centric development, what is their time use pattern, what is the leisure, and what is the developmental participation. So we have to very intricately design this phenomena so that along with care be giving, they can do some income generating activities and get some leisure. For getting this, their rest and leisure, which is very important for their quality of life, we have to introduce them with new gadgets, time saving gadgets, so that they can manage their efficiency. We have to give a community platform where they can exchange their ideas, where they can clarify their doubts, and where they will get motivation to go ahead. So this is very important. So policy matters should be like that. So policy considerations for delicately balancing rural women's time used for economic activities with caregiving responsibilities is the need of the hour, and women-centric rural development initiatives need to be taken care of women's quality of life indicators. Definitely, this is the thought of the day. So, what are the wow factors? Because in this research, what I found that the quality of life, yes, we can address it. Yes, we can measure it with tangible forms. Yes, we can quantify it. So, while doing developmental initiatives side by side, we have to ensure the quality of life the women. So, the recipes being community mobilization for motivation, support and hand-holding, and institutional linkage and enhanced mobility is the with informed decision making. Not decision making, biased decision making, informed decision making will definitely add flavor to the recipe. So, we can cook the recipe very nicely and we can provide women a better quality of life. So, to conclude, so what we have to do? We have to first overcome the socio-psycho barriers through mentorship and support system, then cultural barriers through sensitization, inclusion, participation, then mobility barriers through internalization of opportunities. The women cannot go out always, so we have to provide the required things at the vicinity of their village. Let the inputs be produced by women in their village, and let the women be the input dealers. They must be the input producers. So this will remove lot of mobility barriers and the market barriers through linkage and ICT. So, thank you. So, I will be very thankful if everybody will think a little about that quality of life for women is also important. A woman is a human being. So, by putting more and more and more work in the name of livelihood, in the name of income, we have to look back little and we have to see, we have to stand a while that what is her quality of life? Should I look it before doing anything? So, this is my thought of the day. Thanks for patient hearing. Thank you.